I think Jen, take it away.
Okay, so thanks so much. So much of the concepts from the next few slides were developed based on our experiences using a vaccine champion model in Sunnybrook at large, but also for me in the Sunnybrook Veterans Center, and from our observations from those experiences. But before we start talking about what a vaccine champion needs to do, we need to have a shared understanding of who a vaccine champion is. So starting from the literature, we know that vaccine champions are individuals who are inherently pro-vaccine. They're prepared to share information with peers in their networks and to seek to understand the perspectives of others, particularly with respect to barriers to vaccination. So they might speak about their own positive experiences or motivations for getting vaccinated, and are really crucial to vaccine uptake. And we know that this is really important because we need a very high rate of vaccination in order to achieve herd immunity. Next slide, please. Thanks. So what makes for an effective vaccine champion? And again, this is mainly based on our observations from our vaccine champions work, but essentially we're looking for people who are our connected connectors. So these are people who are regarded as experts or knowledgeable by their peers, people who others go to for advice or for information because they're recognized as being informed or up to date. These are people who are deep listeners who actively listen and empathize and really come to conversations from a place of wanting to understand, not judge others' perspectives and unique lived experiences. Some of our most effective vaccine champions are people who I'd call situationally aware. So these are people who are able to read the room, read their audience, recognize the social cues to know when the right or wrong time for a conversation might be. And above all else, I'd say that effective champions avoid pressure and really seek to support their peers above all else. Next slide, please. Thank you. So some effective tactics that we've used to inspire vaccine confidence can include how we look at information. So looking for information that's reputable and trusted, adapting information as new information comes forward. And I'd suggest here that the key is not just information that's correct, but it's information that resonates with the target audience. And so we'll speak a little bit more to that later, but considering things like what the source is, what kind of language is used in a given source, health literacy and different pieces like that. And this is particularly important in the context of COVID, knowing how new the situation has been and how prone the situation has been to constantly evolving information and just kind of a constantly developing information base. Some specific ways that we've used to engage coworkers in these conversations are small group huddles, something like a fact of the day where we could have small snapshots of information that help to capture specific common pieces of information or misinformation, walkabouts, and being available for kind of those impromptu one-on-one conversations. And overall, just being an open source and open sharing of resources. So again, just wanted to reiterate here that the goal here is to support decision-making by sharing of information and also by providing an open door to conversation. So questions, somewhere where people can ask questions, where people can express their worries. And just have that open dialogue. So at this point, I'll turn it over to one of my colleagues from the Wellness Hub to speak to some of the background to champions work using a behavioral science lens.
Yeah, so thank you, Jen. And can we just go back a slide? So, okay, awesome. So vaccine confidence in behavioral science. So really what we're trying to establish here is that a lot of the psychology underpinning this, there are valid reasons and factors that play into it. So moving to the next slide, we have unique concerns and strategies, and every person you speak with will have their own lens and framework that they are bringing into the conversation. So when you're engaging with people who may be vaccine hesitant, active listening will play a key role to really pinpoint what their specific concern is and identify what strategies might be best for them. So it really is about tailoring your response, and that can be informed through active listening. So just to illustrate a few examples here, if someone is concerned about mixing vaccines and having had a Moderna as a second dose and Pfizer as their first dose, if that person were voicing concerns about that, you could provide trustworthy information about the safety of mixing vaccines. And similarly, if someone has experienced poor treatment in the healthcare system that could have stemmed from racialized mistreatment, then it may be helpful in those cases to look at statistics or trials that included people of different racial backgrounds to help them build their confidence in the vaccine. So the main takeaway here is that everyone has their unique set of concerns, and those are valid concerns, but it takes a lot of active listening to pinpoint that, and then in turn identify what strategy could potentially work. Next slide, please. Now, this is the theory of planned behavior is really suggesting that they have their actions, behaviors, and that's informed by different factors, which are listed here. And we'll go into in a bit more detail about the underlying influences on one's behavior. So next slide. So we've got attitudes. So when it comes to vaccination, people may have a positive or negative attitude towards being vaccinated, and that may stem from fear. So moving on to the second influencing factor, there is behavioral intentions. So if someone we've seen a lot of incentives, people have been given free ice cream after a vaccination campaign. So those may be things that motivate someone to influence their behavior, which would be to get vaccination, to receive their vaccination. Subjective norms is the idea of whether people will approve or disapprove of the behavior. So in a workplace setting, maybe there's a perception that it's looked upon as a positive thing to receive vaccination. And that belief may in turn influence someone to actually go and get the vaccine. Social norms built on this idea, but within a larger cultural context. And I think what's interesting is vaccine hesitancy. It's usually a small pocket of people within the population. The majority of people do support vaccination. But if someone exists within an anti-vax environment or group, then that may be their norm. And that's something to be aware of as an influencing factor in their behavior. Moving on to the fifth factor, which is perceived power. That is the motive, whether they have the ability to say yes or no to a certain behavior. So for instance, with the recent mandates that have come into play, a lot of people are a bit hesitant, or who might have been hesitant are now in a position where they have to receive vaccination, or they're strongly encouraged to, otherwise they have to undergo testing more regularly. And so they may feel that they don't have perceived power, which is the reason they're choosing to be vaccinated. Lastly, there is perceived behavioral control, which is the ease or difficulty of performing the behavior. So if we were to have a mobile vaccine clinic, that is something that may influence their ability or their decision to be vaccinated. So in summary, all of these different factors are influencing whether someone decides to be vaccinated or decides not to be vaccinated. And we have to consider what these factors might be and how they all play into that ultimate decision.
I forgot to toggle my unmute button there for a moment. I wanted to speak to you now a little bit about recognizing and handling difficult conversations. And I want to say that with this section, the intent is not to, give you a list of all of the different possible challenging conversations or challenging topics that could come up, and to give you like a scripted response, but just to give you some background and some considerations to think about to try to avoid or try to mitigate any difficult conversations that might happen. And so I'd like to start that conversation by giving you some things to think about in order to avoid conversations becoming more difficult or more emotionally charged. And so if you remember one thing and one thing only from me, it's the importance of psychological safety. And for emotionally driven conversations and conversations where people could feel that sharing their perspectives or thoughts or questions puts them at some kind of risk, it's really important to create a safe space where the person you're speaking with knows that they can openly share those thoughts or questions without judgment. And again, the focus here, as I've said before, is on support and to truly get to a place where someone trusts you and what you're saying. They have to trust that you have a vested interest in their well-being and therefore their values. So the first rule in psychological safety is non-judgment. And I'd also remind you at this point that your coworkers aren't required to disclose their vaccination status to you. It might be evident just because of the situational context of a conversation or of your workplace, or they may share it anyways, but it's certainly not an obligation for them to share that with you. Going along with avoiding judgment is avoiding having our peers feel pressured to vaccinate. And I think it's important at this time in this climate to make the distinction between pressure that's external, so pressure from directives or mandates, versus pressure from us as peers and champions. So despite the fact that there might be policies or legislation that might lead people to feel pressured to get vaccinated, we don't want our peers to feel that pressure is coming from us as individuals. And so the aim here isn't vaccination at all costs, it's helping support people in their own decision making. Next slide, please. Thank you. Okay, so a second really key piece to building psychological safety is creating a space where the person you're speaking with knows they can share openly without fear of what they're sharing being spread beyond that conversation. So respecting confidentiality, knowing that there can be sensitive or personal information shared in order to build trust. So rule the first was non-judgment. Rule the second in psychological safety is Vegas rules. So what happens in the conversation stays in the conversation, unless you have an explicit agreement with the person you're talking to about, specific disclosure for follow-up afterwards, or, if they wanted you to talk to a certain person about something like that. On the note of psychological safety, so there's psychological safety for the people that we're talking to, but also safety for yourselves. And we wanted to make sure that all of you also feel safe in these discussions, and knowing that these can be emotionally charged. These situations can sometimes escalate. So before you start having some of these conversations, it can be useful to potentially look at de-escalation techniques or look for potential sources of support for situations that could escalate. So basically having a plan in place, hoping that you never have to use it, but knowing that it is there as a backup in case you do need it. And this could include looking into policies or procedures specific to your workplace and related to harassment or aggression, or it could be thinking about how reporting of these situations looks in your particular context. And there are some extra resources in the link on the slide, and the slides are, as we said, going to be shared after the fact. Next slide, please. Thank you. So now that we've talked about psychological safety, I wanted to share some tips and tricks, do's or don'ts from the Institute for Healthcare Improvement. And again, this conversation guide should be in the resources list as well. So starting with the do's, so be clear about the purpose of the conversation. So this is a way of having mutual understanding about the conversation that's about to happen. But it's also a way for us to get permission from our peers that this is a conversation they want to engage in at that moment. So it gives the person we're talking to the opportunity to say no, or that it's not the right time, or that they might have, other considerations that could factor into their ability to have that conversation at that exact moment, be it other tasks or divided attention or anything else. Another thing that's really useful to do is to use open-ended questions. And one way I frame this is to take the pressure off of having to always have the right answer by being a really expert question asker. Sorry, not always have the right answer, be a good question asker. The more you really deeply understand the root causes to someone's worries or fears or values, the better you can tailor the conversation to what the person really needs to hear. And so talking about shared values is also very important. So creating empathy by connecting with the root values underlying concerns or questions. So if that's safety of self, if it's family togetherness, if that's safety of family members, whatever that underlying value is, oftentimes there's some kind of thread that's common between all of us as human beings. And sharing in that connection can help to communicate that you're really on someone's side. The next point that we have as a tip or trick is use of mutually respected evidence. And it's important here to acknowledge that not all sources are trusted equally and by everyone. So some things to consider could be digging into the why of why certain sources might be trusted or not trusted. And so understanding why someone does or doesn't trust certain sources can help you find resources that do resonate with them and be most meaningful to them. And so oftentimes, regardless of source, there are some kinds of elements of truth that can, help be a source that someone trusts, but also is a source that can be, again, really powerful to them. So give yourself permission to, share that you're not an expert in all realms, and ask if you can circle back, legitimize the value or worry that's underlying some of the questioning of a specific source, and keep the door open for another conversation, because sometimes these conversations aren't a one-time deal. So it can help to acknowledge when you don't know something, don't make it up. And it can help to build trust when you actually hold yourself accountable by saying, I'm going to look into this for you, and actually do. Our last tip is to use non-judgmental questions and affirmations. And this goes in line with what we said before about empathizing, about communicating that we're as individuals and as peers, and that emotional reactions are all legitimate regardless of how accurate the information that caused that emotion may be. So in order to be able to engage with our peers on an intellectual or informational level, they have to know that we support them on an emotional level. Now, conversely to the do's, we have some don'ts as well, some quick don'ts. Again, the aim here is support. It's not influence. It's not coercion. And the hope here is that people are engaged in the conversation with you because they're open to hearing different perspectives. But it's also possible that some people just need trusted people with which to voice their concerns. So don't be overly argumentative or technical. And again, opt for empathy over judgment. Don't use positional power. And we also call this coercive power. And this can certainly undermine trust in the sense that you have someone else's best interest in mind. Don't label groups. This can create real division and worsen issues of trust between perceived groups. And don't use language that disrespects someone's autonomy or ability to choose. So words like refuse or non-compliant or resistant can make someone feel like they don't really have a choice. And you'll notice that we've talked a lot about vaccine confidence and haven't focused as much on vaccine hesitancy in this presentation, and that's a conscious choice as well. So lastly, don't ask leading or blaming questions. And if a question has an obvious right choice, it's perhaps not the best way to frame the question. And we want here to avoid pushing peers into a certain line of thinking or to feel lesser because of their opinions. Next slide, please. So some last key points before I pass it on to another of my colleagues for the next section. I just want to reiterate some of the points we've already discussed. So always be respectful. I'm sure that all of you are. You're very interested in having conversations with your peers. That's why you're here. And validate the person's values or worries or fears. Know that those fears can be legitimate. So there are some communities that have historical reasons to mistrust either the system or authorities or other bodies. And it's important to acknowledge that lived experience and know when to stop a conversation. So read the cues of your peer. Know when it's no longer the right moment or the right place, or when someone might just need a break. And again, you can always ask permission to continue the conversation at a later date and know that it may not be one conversation. And, again, giving someone the opportunity to opt out, because the goal here is confidence and support. It's not a decision to vaccinate at any cost. And so at this point, again, I'll pass it on to my colleague and who's going to speak to some of the changes in light of some of the changing environment, I should say, around mandates.
Yeah, thank you, Jen. And so with recent mandates in long-term care homes, and even with the rollout of the vaccine passport, a lot of our conversations may be focused on that. And people may be expressing their frustration with these mandates. And what we talked about earlier next slide, was linking strategies to concerns. And so when we hear, something like everyone around me is vaccinated, why do I need to get it too? Or concerns about the fact that we need to have mandatory vaccination in these high-risk settings, we can tailor our response. So saying something along the lines of the community immunity only protects us if enough people are vaccinated. That might be a way to broach the subject. And I don't want to spend too much time on this because I'm aware of the time, but again, this just goes back to linking concerns with strategies. And this is something that is likely to come up, especially as mandates are coming into effect. Next slide. And we're going to move into addressing common vaccine myths. And Dr. Weinerman, you can take that away.
Thanks, Jyoti. So I'm not going to spend too much time on addressing common myths today, because that's not obviously the primary focus of today's talk. However, it is obviously important that any vaccine champion has confidence in the vaccine and some fundamental knowledge about the safety and just how well the efficacy of the vaccines. So it's important for everyone to know, as I'm sure almost everyone, if not everyone on this call already knows, but just to reiterate that all the vaccines that are currently available have gone through the standard clinical trials that all new vaccines or drugs would go through. The thing in terms of the timeline, a lot of people talk about the timeline being shortened. The timeline was able to be shortened because the administrative burden was decreased. So just like anything that you're trying to change in a long-term care home or any healthcare setting, it can take years and years and years until there's a pressing issue and everyone sort of works together to move things along. But there was no clinical stages that were missed or shortened in any way for the vaccine creation. It's also important to recognize where we are now, which is quite different than a year ago. So billions, with a B, billions of people worldwide have now been vaccinated. And including clinical trials, people have now been vaccinated for over a year. And those primary true facts are often missed in a bigger conversation. What we also know from billions of people being vaccinated and us following very closely to look for any safety signals is that serious side effects to these vaccines are exceedingly rare. So these are safe vaccines. And then from the perspective of how well do they work? Well, fortunately, even better than the safety is that they work very well. And so even against the current circulating variants, the vaccines still are holding up very strongly. And even if a person does get infected despite being vaccinated, which yes can happen because nothing works 100% of the time. The good news is that what we're really trying to avoid, which is serious illness, someone having to go to an ICU setting or requiring a breathing tube or obviously dying, the vaccines do an incredibly excellent job in real world settings and in the clinical trials of keeping people safe and having a milder course of infection if unfortunately they are infected despite being vaccinated. Next slide. Here's just a few common myths. Again, not going through all of them because there's a lot out there, but just some of the high things to know. The vaccines cannot change your DNA. They do not contain fetal tissue. There's no implantable, trackable microchip, probably in contrast to the cell phones that we also willingly carry around with us on a daily basis. One important myth, though, that I'll spend a little bit more time around is pregnancy and breastfeeding. So understanding, and I saw that come up in the word cloud again about pregnancy, there's no scientific reason why we would think these vaccines would be harmful for individuals that are pregnant or breastfeeding, but obviously understand the heightened concern for some of the individuals in these situations. Fortunately, now we have real world data, because pregnant individuals were not included in the initial studies, that vaccines are just as safe in this population as they are in everyone else. And the important corollary, the flip side to really understand, is that what we're seeing, unfortunately, in real world experience, and that has then formed the basis of larger studies, is that individuals that are pregnant that unfortunately end up infected with COVID have a higher risk of ending up very, very sick. So often ending up in the ICU, even with a breathing tube, having babies that are born preterm, or having babies that end up in the NICU. So there's a very real risk for individuals that are pregnant in getting infected with COVID, and really no risk above the general population, which we've already said is quite safe for them getting vaccinated. And from a fertility perspective, again, understand the concern, particularly people that are struggling with or have struggled with infertility. There's again no scientifically plausible reason why this vaccine, or really any vaccine in history, should impact someone's fertility. Although I will note we're seeing more and more real world data that some people's menstrual cycles for 1 or 2 cycles after vaccines can be affected by the vaccine, similar to if you travel or stress or things like that. This is not a permanent change. So may affect your likelihood of getting pregnant in those immediately 2 cycles after, but in no way would impact long-term fertility. And the reason I highlight that is, again, to what Jen said earlier, you can't just ignore everyone's concerns. You have to be able to hear them. And if you ignore every single thing that someone says, oh, I thought my menstrual cycle was different post-vaccine, you're not really listening and understanding what people do need to know to sort of build that trust. Next slide. So I won't go into this in too much detail, but again, just to say it's important, and Jen's already alluded to this a lot and others, that any champion recognizes that even though some of the myths seem incredibly silly to some people, that these are often deep-rooted reasons why people may hold a certain belief, and there's so much misinformation out there that they could have read something in a source that they consider reputable and believe it for that reason, which is why it's so important to hear people out. Next slide. I'll just finish by saying, again, we'll send out these slides after. There's a lot of credible resources out there. These are just some examples, and Jen's already highlighted the IHI and sort of taken some things from that. But again, I'll reiterate what Jen said earlier, that when you're speaking to someone, it's important that you're finding them a reference that they consider to be credible. And that might look different depending on who you're talking to. So these are some great resources for yourselves and potentially to pass on to other people in conversations, but they're not an exhaustive list of resources depending on what people are most comfortable with.
All right, so shifting gears, we're moving into the